Good morning, everybody. It's 8 o'clock, and we'll call the Public Protection and Judiciary Committee to order. Just because we have a full agenda today, I note that everybody is present either on Zoom or physically here, so we'll show on the roll call that everybody is present. And we'll go to approval of minutes, and I would ask somebody to move the approval of the minutes with one exception, and that is to show that Paul Burning, Supervisor Burning, did join us for that meeting. And that wasn't recorded in the minutes. So with that amendment, will somebody move the minutes from our last meeting?
So moved.
We hear a second?
Second.
The minutes are approved, and we'll go to public comment. Is there any public comment? Any public comment? Any public comment? Hearing none, we'll move to our business items, financial report with our County Administrator, Pat Thompson.
Thank you, Mr. Chairman. As I reported on Tuesday at our county board meeting, the financial reports reflect financial activity through the month of April, 1/3 of the fiscal year. So the departments that are within the Public Protection and Judiciary Committees, we start with the Circuit Court. Both revenues and expenditures are within that 67% benchmark. Then we will look at the Clerk of Courts. Revenues 62%, expenditures 75%, so that budget is still in line. Medical examiner 67% revenues and 89% budget remaining in expenditures. Criminal Community Justice Coordinating Council, the revenues are at 85% remaining. We have a state grant of $146,000. Year to date, we've collected 25 with an outstanding balance of 121. I think that is reimbursed quarterly. Expenditures are at 63% remaining. District Attorney revenues 72% and expenditures budget remaining 70%. Child support revenues are at 103% remaining. There are no revenues yet on the state grant, $845,000. We start collecting that mid-year and then in the fourth quarter. So those grant revenues will show up a little bit later. Expenditures are right where they should be, 78%. Law enforcement, 66% right on target with revenues, and expenditures 75% budget remaining. Corrections, same. Revenues are okay, and expenditures are at 73% budget remaining. Emergency management, revenues are okay there. The several grant dollars haven't been reflected yet, but those come in like the other department, Community Justice Coordinating. These grant revenues come in a little bit later. And then expenditures, actually 97%. I have to look at that because there's a lot of budget line items that there hasn't been any expenditures made, so I'm going to check with Ken on that. And then emergency communications, revenues are right where they should be, and expenditures are at 61.4% budget remaining. So all the departments are right where they should be. But as I said to the board the other evening, we're watching things real closely. I mean, we always do, but we're always we'll keep a even closer eye on expenditures for these departments because all of them have been impacted by COVID. Thank you.
Thank you. Are there any questions? Hearing none, we'll move to the next item. That's the review of the emergency order. Just by way of background, a week ago Friday, in response to what was happening in Minnesota, the chairman of the county board issued an emergency order dealing with public protection. And on Tuesday of this week, 2 days ago, the county board considered that emergency order and ratified what the county chairman had done. And there was extensive discussion of it. And the sheriff gave a long explanation of what his department has done, a thorough explanation, I should say, and it was adopted unanimously, I believe. Was there one vote, county administrator, against it? Yeah, I'm sorry. There was one negative vote, and otherwise it was adopted. We're going to cover a lot of this in the last item, the response to the Minnesota emergency with the sheriff. But does anybody else have any comment on the emergency at this time? Any updates or questions? If not, we'll move to the reports of the departments, and Judge Needham.
There has again been a fair amount happening since the committee last met. I was part of a statewide task force that Chief Justice Patience Rogansack formed to address reopening the courts as well as re-engaging jury trials, all of which have been put on hold since the pandemic. The Supreme Court's orders pretty much limited our ability to conduct any in-person hearings or proceedings. The task force that I was on was made up of judges, health professionals, court administrative staff, attorneys, and it was an extremely aggressive commitment. We were formed, as I recall, second week of May, and by the third week of May, we had our report finalized. We made recommendations to the Supreme Court, and the Chief Justice then presented those recommendations to the full body of the court. They have adopted all of the recommendations that came out of that group. And counties have now been charged to form what are called stakeholder groups made up of all of the essential players in the court system: county administration, judges, attorneys, public health, law enforcement, you name it, we have representation. So 2 weeks ago, St. Croix had their first task force committee meeting. We broke the group up into 3 subcommittees to address re-engaging in-court proceedings, re-engaging jury trials, and then facilities and equipment. Each one of my colleagues was then paired with a subcommittee, and I gave them an equally aggressive timeline to come up with plans and recommendations. The Supreme Court rule that was mandatory for all counties will require masking of all participants in court, except for witnesses who it's necessary to assess credibility. They will be permitted to not mask for that limited purpose. The rule also requires a plan for frequent sanitizing of used spaces, so counsel tables, witness docket, any place where there's touching, the rule has to have a plan for a frequent sanitizing and cleaning. The full task force meets today at noon, and I'm hopeful that we will at least have a consensus as to what this plan will look like in St. Croix County. The judges will then finalize it and present it to our chief judge, Judge Boyle out of Barron County. She has to sign off, and hopefully she'll agree with our plan, and at least for right now, we're targeting July 1st as being back to full operational status for in-person hearings primarily. Those that we can continue to do by Zoom or telephone, we will, but as of July 1, we hope to be up and running, likewise up and running with jury trials. Jim Ellsbury has been nothing but helpful and accommodating and helping us figure out what that's going to look like, given the requirement for social distancing, the requirement to keep jurors safe, keep litigants safe, and at least the plan is to reconfigure Judge Nordstrand's jury box to accommodate 14 jurors safely distanced. That work, Mr. Ellsbury is relatively confident can be done by July 1. What that would mean then is that we'd have to prioritize jury trials, so we would only be able to conduct a jury trial in any particular time. And the plan is to prioritize, again, if it's a constitutional or statutory right, those would be given priority. And the 4 judges then would coordinate their calendars so that whoever had the jury trial would use that courtroom. We talked about, should this be a permanent, should this be temporary? And our definition of temporary, we don't know. And so we're hopeful, this would be a 6-month project, but more realistically, we're hearing it could be a 2 or 3 year project. And so we're going to make it quasi-permanent in terms of the actual construction part of it. But that's our plan, and that's what's happening in the courts.
Does anybody have any questions for Judge Needham? I will simply add that on Tuesday morning, I was part of a meeting with Supervisor Hanson that chaired by Judge Nordstrom, in which the Criminal Committee of the CJCC, in which he also gave a thoughtful review of what was happening in the courts. And I think we came out of it very confident that you folks are really doing a terrific job. And as you say, Jim Ellsbury has done a great job working with you, and I think it's going to come off as smoothly as it possibly could. Thank you, Judge.
Thank you.
Are there any other questions for the judge? Not hearing any, I'll turn to our medical examiner, Patty Shackler, and she'll be followed by Christy Severson and Lisa Plunkett after we hear the medical examiner's report.
Okay, good morning, everyone. So from the medical examiner's office, we've been working trying to streamline our processes now that we have a program coordinator, and we have really accomplished a lot with that. We now have lots of different documents we can do digitally, which we haven't had before. We're also working on the accreditation program, so we're hoping to have our medical examiner's office accredited in our goal is 5 years. It takes a while, but it would be the only one in the region on this side of the state that would be accredited. So with the building and now just working on all our processes and stuff, we're confident, and we are working with Ramsey County to make sure that we meet all the desired requirements for accommodation, so it will, or accreditation. So that would be a big asset for the whole region as far as medical examiners go. Recently I sent Janet the list of all the CBRFs, nursing homes, and group homes in the county. The reason we had this conversation was really to see what that population was. My dad is in a nursing home, so it's just trying to figure out, we know what's going on. So recently the nursing homes have set out COVID plans. So what that is if there was an outbreak, what is it that you want to do? So when you put that in mind, that if you had an outbreak at a facility, whether it was a CBRF, a nursing home, or a group home, do we have the capacity here to take care of that? And with our cooler, we do. So I think it's really important that we keep our reefer truck at least through the summer and then reevaluate after. Right now, we only have capacity with all our funeral homes and the medical examiner's office. If we didn't have the reefer truck, capacity for 6 people to be in refrigerated. So with our refrigerator truck, we have the capacity for 46 people. So we don't want to be that county that doesn't have capacity. The other thing that why I'm really stressing this is our two funeral homes that have crematoriums, also 100% are the crematoriums for another county. So they have businesses in 2 counties. So we're already seeing that capacity being increased because whatever calls they get from that other county comes into our county. So having that refrigerator truck is really important. And with our, we had a decreased number of autopsies. It should be budget neutral. It should be fine. So I'm watching it closely to make sure that there continues to happen. But I think the refrigerator truck is a good thing overall, just so that we don't find ourselves in a position that if we did have a lethal outbreak, that we didn't have the capacity to treat and care for all the decedents respectfully. This week, we were asked to join in on an Amos project, so we are, and it's a unidentified male that is buried in the county cemetery from 1950. So we started, we've got the groundwork kind of started on that there, and now we're doing information gathering, and so we can see where this came from, and then hopefully send it over to NamUs to start working on that project. So for us, it's, that research part is interesting to get into. Hospice continues to be, we're getting about 2 to 3 people register for hospice a day. So that there is not changing, and when you look at everything that has went on, our call volume is actually increased from last year, even though we haven't had an increase in autopsies or accidental deaths. Now that everything's open up, I would imagine that accidental deaths will increase again through behaviors, and we're prepared for that also. So with that, does anyone have any questions?
I have one question. I understand that the Minneapolis-St. Paul hospitals are near capacity with their COVID-19 patients, and they may be sending some to St. Croix County. If a person passes away in St. Croix County, how is that counted statistically? Is that a Wisconsin-St. Croix County death, or is that a Minnesota death?
So the way the statute reads, if they die in St. Croix County, it would be a St. Croix County death. But the same would hold true if we had someone who had COVID and was transferred to Minnesota. So there is a way to go back to point of region in that. But even when you think about it, if someone got in a car accident here and was transported to the cities, that death gets recorded over there, even though the data is over here. So that's nothing unusual. So we can kind of go back within the state, but, you know, different county to county, but not state to state.
Supervisor Burning.
So do we have a plan, since we have a new communications guy who's sitting back there, to make sure that we can calm the storm out there that will happen? Because, you know, the moment, if that happens, the moment that happens, I can only imagine I'd open my smartphone and hit that little blue F button, and it would just be ablaze with rumors and, you know, how are we ready to get the facts out there that maybe that was a Minnesota resident who was transported over here? Are we ready for that?
We can be. I'd never thought about it, but, you know, I'm always the final chapter in the story. So we can set up something with us and public health to figure out how that looks. Because, yeah, you're right. I mean, there's a lot of, the process of signing death certificates has not changed. It is the same thing as today that it was, 10 years ago, that it was 15 years ago. It has not changed. When you look at the death certificate, you're looking for 2 things, cause and manner. So manner is just, was it natural or not? Cause, and we have had lots of questions on this. So if the person died from pneumonia, and so that would be the primary cause, and then you put down what's the interval. So was it days, minutes, so it's pneumonia. Then the next line is due to. So was it due to COVID? Was it due to aspiration? Was it due to injury? Then it goes down. So when people talk about comorbidities and how that fits in, that's what it is. And then on the bottom, there's also a contributing factors. So you could have had pneumonia and then had COPD, and then down here also had COVID. It would all be on the document, but that's the way it is for everybody, and that hasn't changed. So when we look at all the data that comes out annually on, and I mean, I dig that, so I go through it to see all that stuff, but I mean, that data has not changed. So I don't, there's, if it was COVID, it has to be documented. So they have to have tested positive. If it's a probable, then it would go down on the bottom and not on the main part of the diagnoses. So does that answer your question?
It does. But the main thing I want to just make sure is, since we got a guy, let's make sure we're utilizing him and making sure that the public stays calm and understands if that's the scenario. I guess no matter what the scenario is, if it is a resident of St. Croix County, you know,
Either
just
way,
to
we'd
just
have
to
to have a
make sure
plan.
that we have a way of communicating and it's not 17 stories floating around out there.
Right,
I think that's the key, and then something that we can tell our constituents as we get 47 phone calls on a weekend or whatever.
So we also did a flow chart of all the, with all the agencies for the deaths on what's COVID and what's not. So when we do our initial phone report stuff, that is the primary question. We ask that. So I can share that with communications and just how our process is and what we've done. And all our agencies are the same. And I would think that until there is a death certificate, it would be hospitals' information and not the medical examiner's information to share.
Mr. Chairman? So I just had a quick comment on Patty. So I'm wondering, I think that it would be a public health coordinated statement more than likely, maybe in conjunction with the hospital, but I know that's how other counties have done it, is if there is a death, that there's a statement that's drafted, and I think it's combo between public health and hospitals taking the lead in the information transmission.
So, yeah, we, with public health, we're coordinated all the time, but our office doesn't issue statements. We stay in the weeds, so that.
Right, that's what I mean. I think that it would come from public health more than likely than your department. But you would be working together, obviously.
Yep.
Administrator Thompson.
So Patty, if you have an unexplained death and there's a lot of, is it comorbid factors related to the death, but COVID hasn't been diagnosed, or there hadn't been a test prior to death, what does your office, if there's any suspicion that it could be COVID related, does your office test?
So that's a good question, and the answer is yes. So we have been testing all of the unexpected deaths, and we partner with Kelly, and she has been coming out to the scenes and doing the tests herself and sending them right to the state. Because, you know, with unexpected deaths, then family members are consistently saying, what if? So we've been doing that, and our time factor? Yes, because they have to stay, it's like 70 degrees below zero. They have to be super cold, and they have to be shipped really fast, and we get results within 24 hours.
So what I mean, is there a time period where the test has to be administered?
Oh, so we have been doing it within 12 hours. So if an estimation of 12 hours, anything over 12 hours, it really doesn't make any sense to do that.
Thank you.
You're welcome.
Any other questions for the medical examiner? Hearing, we'll turn to the report from our clerk of court, Christy Severson, and I would simply say that we've been trying to hear from all the different entities that this committee has oversight of. We heard from most of them last month, and this month we're hearing from the clerk of court and our child support department, and that will conclude kind of an orientation for the committee members on the various areas of which we have oversight. By the way, I'll say that Christy will just be giving an overview today, and she's very graciously invited everybody, if we would like to go by her office, she'd be happy to give a more in-depth presentation on the amazing amount of paperwork that goes through that office. Ms. Severson.
Good morning, and thank you, Supervisor Fiedler. My name is Christy Severson, and I'm the Clerk of Court for St. Croix County. The Clerk of Court is the official record keeper for the courts. We currently have 17 staff members, which includes myself, 2 additional supervisors, 2 financial assistants, and 12 deputy clerks. We also have 4 part-time civilian bailiffs that I'll speak of briefly. They're integral to our jury division. The clerk of court is responsible, as I said, for many statutory responsibilities. We're the custodian of the record, court administration, jury management, and court finances. We have multiple divisions within our office. That includes our civil division, which is for money claims that are over $10,000, foreclosures, restraining orders, and name changes. Our small claims division, which is money claims under $10,000, as well as evictions and replevins. Our criminal division, which includes both felonies and misdemeanors. We have a traffic division, which includes both criminal traffic and civil traffic, as well as forfeitures and juvenile ordinances. And our family and paternity division, which is our divorce and paternity actions. And then our financial team, which handles not only our day-to-day bookkeeping, but also collections, including things for restitution, GAL fees, and court-appointed attorney fees. One small note on our financial team is we began turning debts over to the state debt collection through DOJ about 17 months ago, and to date we've collected over $354,000. So why our revenues look much better than in the past is because of the efforts of those staff members dedicating a lot of time in order to collect old debt. And we will be continuing, obviously, that program into the future. And then finally, our jury division. I did a 5-year average, and we average between 25 and 30 jury trials per year, which means we qualify about 2,500 jurors per year, which are residents of St. Croix County. We summons in about 1,500 jurors per year. We do orientation for between 850 and 950 jurors per year. We select between 250 and 350 jurors per year, and then we pay all those jurors. So a lot of time goes into our jury system. So I want to give a shout out to all my staff. They don't always get recognized, so I wanted to say their names. Anna, Bree, Jess, Jamie, Cheryl, Heather, Christy Minot, Edie, Anna, Katie, Kathy, Melissa Benoit, Greta, Kendra, Shelley, and Mel. Very hardworking staff, dedicate a lot of time and commitment, have helped through this COVID new normal, as well as so many changes throughout the years. I just want to give them all a shout out, as well as thanking our justice partners, the judges, court reporters, JAs, court commissioners, register and probate, DA, child support, county sheriff and other law enforcement, including state patrol, county administration, obviously other county departments that we work with very closely with, IT, facilities, finance department, register of deeds, treasurer, everyone else, and this committee as well as the county board. So that's my very brief overview. Thank you, and if anyone has any questions, I'm here to answer them, hopefully.
Any questions for the clerk of court?
You didn't include your name on that list, so I think we should thank you too for all you do.
Pat's my words. I was going to say the same thing. I know I've had several interactions with your office, and every time, I don't think anybody had any idea they were dealing with a county supervisor or anything. They were very thoughtful, very professional, very helpful in every way. And thank you, Christy, and please pass along our thanks to your staff as well. The next report we'll hear is from our child support division, and Lisa Plunkett. Lisa's joining us via Zoom. And Lisa.
Hi, good morning. Good morning. Can you hear me okay?
We can.
All right, great. I am the administrator for the Child Support Agency. We are 9 people strong, so we have 7 specialists that work caseloads. 2 of the specialists are trainers that have senior responsibilities in training staff and answering questions and doing my backup if I'm not available. We have 1 part-time 25-hour per week customer service rep who started yesterday. So we're in the middle of training, and hopefully the goal is to get our office open to the public sooner than later. Our agency is responsible for locating parents, absent parents, establishing legal obligations for child support and medical support, adjudicating paternity for children born to unmarried parents, enforcing the child support orders and medical obligations, also monitoring and maintenance, also maintenance cases with financial records pertaining to the court orders. We work closely with cooperating agencies such as the Corporation Counsel's Office, the Family Court Commissioner's Office, the courts, the Sheriff's Department, the Register and Probate, the Judicial Assistants, Clerk of Courts, Treasurer's Office. We have cooperating agreements with all of those agencies, which they report to me and provide their work monthly, and then I report that to the state. Our agency receives reimbursement for the actual allowable expenses, which is funded 66% by the federal child support program. We also receive funding through contract awards and performance incentives through the state of Wisconsin. We receive revenue from recovery of costs as pertaining to like service of process fees that the court orders an individual to reimburse, genetic testing fees, medical expenses, and we also have a contract with Buffalo County. So we administer the child support program for Buffalo and Pepin County child support agencies. I hold the position of the coordinator for those two positions. It's typically about maybe 10 hours a week, sometimes more, sometimes less. And I'm just making sure that everything is flowing correctly. All the policies are being followed, and then contracted staff are doing that work remotely. Our agency is funding is based on 4 performance measures. We need to collect at least, at the minimum, 80% of current support owed, 80% on cases that owe delinquent child support. So if anyone owes $1 delinquent child support, if we collect on that, it's considered a percent. So we have to get at least 80% of our cases with at least one payment in the fiscal year. Our fiscal year runs October 1st through September 30th. We need to establish 90% of all our cases where children are born out of wedlock. And we need to establish 80% of all of our cases that need establishment or need a court order. We have to establish that on 80% of our cases based on a federal requirement that the state tells us what our caseload is based on the they have a numerator denominator function that tells us how many eligible 4D cases we have. We could have from 1 to 10 cases per caseload, depending on if the child has been placed out of home, if the child's been in and out of foster care, if the child has other guardians, if the roles reversed where the mom has full placement versus the dad have full placement. So we could have multiple cases based on one actual court case number. Our current standings, we are ahead of the game. I think my staff deserve a high five because working remotely, although we've worked remotely in the past, this is strictly working remotely. We've come together as a great team. We have weekly meetings. Because of this, we have increased our performance from where we were at this time last year by at least a few percent. So I'm looking at the numbers that we are right now. So last year at this time, or right now, currently, we are at, oops, I got the wrong screen up. Sorry. We are at 76 0.34% in our arrears percentage rate. That's the performance level that we struggle in. Some of these cases we consider them dead cases. We can't find the participant that owes the money. There's other underlying circumstances. They're on Social Security, or they're disabled, or they're unemployed, or they're incarcerated. And so being at 76% at this time of the year is wonderful for us. We are doing great. We're over all of our benchmarks for the remaining percentage. We're at 89.64% for court-ordered establishment. We're over 100% in federal paternity establishment, and we're just under 82% for our current support collections. So we're doing wonderfully. Once we can get our customer service rep trained and working at this front desk, we'll open to the public under some terms based on whatever the health department, Kelly or Natasha, can give me some suggestions, precautions, things like that, as they have done for the clerk of courts and the treasurers and the county clerks. So that's kind of my overview. Does anyone have any questions?
Are there any questions for Ms. Plunkett? I would simply say then thank you for all the work you and your staff do, and I know you're not quite as high profile as some of the other folks that regularly appear before the committee, but obviously an exceptionally important role that you and your staff perform for the county, and congratulations on reaching all your benchmarks or exceeding them so far this year. We appreciate it.
Thank you.
I'm going to surprise somebody in the room now. I'm going to turn to Mike O'Keefe. I should have probably turned to Mike after Judge Needham gave his report, because Mike is the key staff member on the CJCC. And Mike, do you have any report you'd like to give on the subcommittees of that committee?
Thank you, Mr. Chair. Really, the only subcommittee that's met so far has been our Criminal Justice Subcommittee. We're re-engaging through Zoom meetings, which is different for me. I'm kind of old school that way, but it's working well. We should have reports from 3 subcommittees at our next CJCC meeting: domestic violence, family issues, and treatment courts. With the transition of Fred Johnson with the new HHS director, that's going to take a little bit of work because he chaired 2 of our subcommittees. So we've got to make that transition as soon as I get to meet him next week. So that's it.
Any questions for Mr. O'Keefe? Hearing none, we'll turn to Carl Anderson from he's an assistant district attorney in our district attorney's office. And Carl, feel free to give a general report if you'd like on the district attorney's office, but I know he's going to focus specifically on something we raised last month, and that is the general area of elder abuse and what our district attorney's office does with regard to that. And I will add that I think at our last meeting I'd mentioned I would bring this up to the ADRC, which I then did, and they also basically support the idea that sometime in the fall, perhaps September, we might focus on having I'll just say a 2-3 hour program on elder abuse, and try to bring in a variety of people from the judiciary, the district attorney's office, the sheriff's office, bankers, lawyers, trustees, others who have had experience with that, so we can do all we can to prevent those forms of elder abuse. Mr. Anderson.
Thank you, Mr. Chairman. So as Chairman said, I'm an assistant district attorney with the district attorney's office. I've been working on creating an elder abuse task force for St. Croix County. The reasons for creating a task force is there are very unique laws when it comes to elder abuse, such as, what can a power attorney do, what constitutes theft by a power attorney. So we want to create a task force to have investigators who specialize in those kind of cases, so when they come up, it can move smoothly and quickly, because a lot of times with elderly patients, time might be of an issue. We want to have at least 1 or 2 prosecutors assigned to it who will also specialize in elder abuse cases. I've spoken with Sheriff Knutson about this previously. I've spoken with Chief Willems from the Hudson Police Department about this. There are there's a statewide initiative led by, his name's Mike Austin from the Department of Justice, to assist in creating task force, elder abuse task force, and they offer free trainings. He said that they can bring trainings to St. Croix County. They have ones that are specific for law enforcement and other ones that are specific for other members of the community that work with elderly populations. The goal would be to do, the plan is to do this without any extra cost to the county, using resources we already have, investigators we already have. Agencies have budgets already to send officers to trainings, as well as the DA's office, but Mike Austin said that they can bring trainings here at no cost because they have their own budgets to do that also. As Mr. Chairman Fiedler said, another goal is to do a seminar, a morning seminar similar to the domestic violence seminar that was done at Faith Community Church, and maybe we could do it at Faith Community Church also. And the goals would be to spread awareness about elder abuse, Mike Austin said the task force that are successful are the ones that get engagement with the community organizations. So we'd want to try to foster relationships by bringing everybody together that deals with that. So the Aging and Disability Resource, the Department of Health Services, social workers, prosecutors, law enforcement, get as many people as we can who work with those populations and who would be involved with something like this in the same room to give basic overview of the laws that are applicable, to spread resources that the county already has, and to bring these kind of groups together. And as Mr. Fiedler said, a banker, forensic accountant, if anybody has ideas for somebody who could speak, or a lawyer, either private bar, somebody who does a lot of elder abuse cases, or a judge who maybe has had a lot of elder abuse cases. I'm going to speak with Mike Austin and see if they have an investigator that could speak who's very familiar with elder abuse cases, and then maybe somebody from the Aging and Disability Resource Center or Department of Health Services. That's just a really quick overview. This is all still in the planning phases, but we're hoping to keep things moving quickly. So given the aging baby boomer population, this is probably going to become more of an issue. Statewide, they're seeing an increase in elder abuse cases, so we're trying to get ahead of it.
Are there any questions for Mr. Anderson?
And maybe not a question, Mr. Chairman, but would you also consider including vulnerable adults in that same type of, because I've had more of the vulnerable adult exploitation than sometimes the elderly, so I'm just suggesting that you might want to include vulnerable adults as well, those who are under guardianship or some other type of disability, who oftentimes I think are subject to the financial exploitation part of it. So
I agree. A lot of the same issues apply to both.
Any other questions for Mr. Anderson? Otherwise, thank you for taking the lead on this, and look forward to working closely with you on it. The next couple of items on the agenda and our last items are from the Sheriff's Office, and there's just, I think there's been a little activity in the Sheriff's Office over the last month, and particularly the last couple of weeks. I think the first person we'll be calling upon is the Deputy, Kathy Borgschatz, to talk about various programs that are now underway in the office.
So, Mr. Chair, I'm sorry to interrupt. Dan messaged that his mic is broken, and he wanted to ask Mr. Anderson if he would be having small meetings like coffee chats with seniors at the ARGC senior dining sites.
That's not something I've thought of before, but I think that's a good idea and something we can look into for sure.
Thank you, Shelley, and thank you, Dan, for asking that. I'll turn to
All right.
Deputy Borgschatz.
All right. So prior to the pandemic, March, we had been making efforts to change up our programming in the jail to concentrate more on
re-entry into the community, not just having programs within the jail that take up time. We wanted to, if we were going to have programming, we wanted to maybe affect some sort of change or extend their sobriety once they were beyond the jail. Then COVID hit, and our ability to bring folks into the jail as volunteers came to a screeching halt. So over the last couple of months, we've been, again, reinventing what we want to do for jail programming. One of the biggest things that we had to overcome was the technology portion. In our classrooms, we did not have Wi-Fi. So we had to work with IT and get some Wi-Fi leads into those classrooms so we could begin to have video conferencing that we've all been part of over the last couple of months, and that's been completed. We've identified the folks that have been court-ordered AODA. I believe there's 8 of them in jail right now, and jail admin has been talking with AODA folks from the county to set something up so that can resume. We have, because we have, the gym is no longer, there's some exercise programming that's starting. We have equipment down there, ellipticals, dip bars, treadmills, and there's going to be some form of exercise for inmates to burn off some energy. We also have art therapy that's being developed, anger management. We've also reached out to WITC. They're coming in July. When I say coming, I mean by video conferencing, to do some soft skills with the inmates. And then starting in September, we'll be resuming GED school, so folks can get their GEDs. The other community partners that we had started talking with, Family Resource Center, I was in contact with them a couple of weeks ago. I want to reach out to the sober living folks, Grace Place, some other community partners that I think could help us in this transition from reentry from the jail into the community. I know Supervisor Hansen and Supervisor Fiedler talked about a Stepping Up program. It's a national program that a lot of jails are moving towards. We've done some research on that. I know jail admin and our program coordinator that was recently appointed, they have a meeting on Monday with a county from, I believe, Iowa. They have their program has been up and running. But as Patty talked about, sometimes when you get these national accreditations, it takes a lot of time and there's a lot of hoops to jump through. So we'll be looking at that model, whether we actually go to the Stepping Up program or not. We're still we're reviewing it, basically. So the plan is to reach out to the director at the services center. I believe he starts in a couple weeks. Monday? Okay. We had been in contact with Steve Kurt and Fred prior to the pandemic to get some county resources within the jail, whether it's AODA, mental health, economic support, to get folks on the path. So that with their retirements, it's kind of went to a stall, but I'm hoping to reach out to the new director in the next couple of weeks and re-engage in those conversations so we can get something rolling. So that's where we're at with the jail programming.
Thank you, Chief Deputy. I would just make the observation that at our last meeting, Supervisor Hansen did ask if the Stepping Up program could be part of our agenda, and of course, the answer was yes. Because of the very active last couple of weeks in chatting with Supervisor Hansen and the sheriff, we decided to postpone a full discussion of the Stepping Up program till probably our next meeting. And it does exist in 500 counties across the United States, I think 11 in Wisconsin, including a number in the northwest corner of the state. So we can draw on their expertise and experience. And I know that a lot of things that are going on now in the jail with regard, as you mentioned, to coordination with our HHS staff in the county and others, we do provide a lot of assistance to people with regard to those who come in with substance abuse problems or mental health problems already. But the Stepping Up program is a good program, as Supervisor Hansen brought to our attention, and we look forward to hearing about that more in the future. Are there any other questions for Deputy Chief Borgschatz on current programs that she just described? Mr. O'Keefe.
Thank you, Mr. Chair. I would think the Mental Health Subcommittee or the CJCC could help with that, looking at the Stepping Up program. I mean, we've got all the players at the table anyways, so that might be something to,
That sounds great.
And I know Supervisor Hanson doesn't have his microphone on now, but I'm sure he would concur in that fully, and we look forward to working closely with you folks on that. I would also say that Deputy Chief Borgschatz and the sheriff have really taken the idea of more programming in the jail very seriously and have accelerated their efforts on it. And I think the bottom line, I think she would agree with me, is that these programs do aid in the reentry of our jail population to the community, but they also, good programming keeps the temperature down in the jail, and that's good for the inmates and that's good for the officers who are down there. So thank you so much for doing all those things. Are there any other questions for Deputy Chief Borgschatz? If not, I'll turn to the sheriff for our last item on the agenda, which is basically to review any of the emergency related issues we've had in the last couple of weeks.
thank you, Mr. Chair. Can I go back to a further update? I'd just like to give a DRC update. Where
Oh,
we're at,
absolutely.
as well as, just because of COVID. Today's jail population count is 80. We had gotten down to 65 at the low point for capacity when COVID started, but I'll turn to DRC. So currently we have 309 people on bail bonds, 17 Huber. So the current supervision level for the DRC staff, 309 bail bonds, 17 are on Huber. Treatment court has 16, diversion has 23, family court has 4. Those are all being monitored or in some form, some connection with the day report center. Average drug tests per day. In January, we were at 39.77, February 41.64, and then March 34.46, April was 0.03. In essence, we shut it down. May, the average was 6.17. I'm going to jump down a number of phone contacts. January was 264, February 242, March 324, April was 975. So while we weren't seeing face-to-face nearly as many, we were still attempting those contacts. May we're at 498, we're at 500 in May. So there was still that contact that many of those needed, that at least discussions, how's it going? But again, the higher risk ones were, there's a potential for monitoring GPS, ankle bracelet. So the number of in-person contacts, January was 1,230, February was 1,092, March was 975, April was 20, and May we went back up to 240. We're rolling back into the in-person contacts, but the current day report center, as you all know, is far too challenging for social distancing. So we had utilized the services center in Richmond. Now with the services center in Richmond starting to become more active and get back into their daily activities, there is a trailer now by the sheriff's office that's parked in front that will be the day report center. We will, June 15th?
Yes.
June 15th, we will move operations from Richmond back to Hudson for day report center check-in and utilize that trailer out front. Far more room in there. It's better for everybody, staff and those coming in. So that is, and that's my update for the day report center.
Any questions on the day report center or other activities? Could you then comment on the reaction, Sheriff, of the department to the emergency order that was issued by the chairman of the board and also other general operational issues of the last week in your office?
So as I discussed on Tuesday, obviously the senseless death of Mr. Floyd 10 days ago now created quite a firestorm of protest. It's much civil unrest and a lot of frustration out there by the citizens. Because of our proximity to the Twin Cities, there was some concern that it may get this far, or some of the civil unrest would reach out into the western edge of St. Croix County. Washington County, the officer who started this created this, his house is about 8 miles from here. So we had also been deployed to assist Washington County under the mutual aid statute as they were having protests in that neighborhood, causing the other neighbors and property. So they needed some protection as well. So we responded that Thursday night. We also bolstered our staff along the Hudson area, St. Croix River crossing, just the western edge. Then over the next several days, we had reached out mutual aid to surrounding counties in Wisconsin as well as municipalities. As I mentioned the other night, we had received 15 other agency acknowledgements that responded. Counties, again, municipalities. I had Sheriff Chris Fitzgerald from Barron County, Sheriff Joel Wenner from Pepin County that were up here on Saturday to also assist in our operation. Again, we bolstered with those members. We had upwards and over 30 squad cars on western Wisconsin edge, Hudson and North Hudson. Much of it was for a deterrent. We felt it was appropriate to be as visible as possible. There was plenty of anxiety in the community, in the region, and if something else would have happened somewhere else in St. Croix County, we had a large contingent to respond to that. Each of the agencies within St. Croix County also bolstered their staff. I believe that one of the counts I heard, I think for Saturday night, was that there was, if needed, 80 squad cars available and mobile within St. Croix County that night. That's a number I don't know if I've ever seen in St. Croix County in my time. So we again felt deterrent and presence, patrolling. We had officers positioned in areas that we felt may be targets that were specific targets, such as the Target store in Hudson and along that I-94 corridor, easy on, easy off if people wished to cause problems. We had people up on the hill and right along the freeway. With that came lots of conversations, not only with the county board and the signing of the emergency declaration, which allowed us a little more leeway and transparency of how we could handle things in the event that there was a civil unrest in the Hudson area or in another part of the county, another city, River Falls or New Richmond, where it allowed us to more easily maybe reroute travel, block access if need be. If it impacted I-94, as we've seen in the cities where marches and protests shut down major freeways. So that emergency declaration, again, gave us a little bit more leeway on some things we could handle and preparation for that. It also, again, gave us some resources with the highway department. The discussion the other night was, I think probably the most pointed discussion was an end time, an end date for it. And as I sit here today, I don't know if I could even give a good end date on when I believe. Now, the Twin Cities has, it seems, calmed, and the protests are very appropriate for the downsizing of responses for them over there. I know there's still some concern, there's still some information coming in. Intel information through the Minnesota Fusion Center. We would also rely much upon information of the Fusion Center, gauging our responses, gauging our staffing. There was also some vague Facebook posts or social media that also drove our responses. Again, nothing that we could verify, but it was enough that it caused us some concern in our area down by Prescott, Red Wing. So it kept the western counties on edge and prepared. Throughout Friday and Saturday and Sunday, multiple conversations were taking place with Wisconsin Emergency Management in Madison, Department of Criminal Investigation, DCI out of Milwaukee, the governor's office, in reference to the request of the National Guard and further preparations on what we may need in this area. I had also contacted Administrator Thompson on Saturday to brief him on where we were at, as well as County Board Chairman Dave Peterson. I think the communication as best we could with the information we had and what limited information I could share with what was coming in. And I will say that probably one of my best informative people was Sheriff Dan Starry out of Washington County, because of his connection to the information center in Minnesota, his connection with the sheriffs and the police chiefs over there. So we had multiple daily conversations, and it was also in preparation for if we needed to assist each other. And through this as well, Dan has said anything that we need, his agency will respond to assist us if he has that manpower available. So we have worked well with Washington County over the years. They have been over here many times, as well as we have a combined dive team and combined trainings with their SWAT team and ours. Critical incident training, CIT training. They've allowed us over there at no charge to send our folks through if they have places, so space is available. So it's a great partnership that I will always uphold. So the emergency declaration, again, I don't have an end date to it. Madison, they are still requesting officers to assist in Madison and Milwaukee. It seems that much of the civil unrest has now entered that area. So while still in Wisconsin, there's still a lot of work and phone calls up here. Madison, through Wisconsin Emergency Management and through the EPS system, Emergency Police Services. I'm the director for the 9-county region, so I've been in contact again multiple times with Madison, even over the last couple days. While it's not active here, I'm still getting information from down on that end and trying to coordinate resources from our 9-county region to assist in any way possible. Green Bay, Madison, those have been the two. Milwaukee has not specifically requested, but Madison and Green Bay are looking for resources, not only manpower, but equipment. Again, some of those things that they're requesting, we are not in the position to assist. But again, a lot of uncertainty in many areas. But I think it's important that we still keep abreast of things and keep listening to the information coming out of all certain areas. So,
Are there any questions for Sheriff Knudsen? Supervisor Burning.
Yeah, Sheriff, thank you for the hard work put in this weekend. I know you probably didn't get a whole lot of sleep. I do have a question for you regarding our ability to mobilize the other counties if something were to happen. How is the communications network between you? How quickly can they mobilize? And Do you have what you need in order to be able to do that?
I believe we would utilize that EPS system. So while I'm the director here for the 9 counties, the representative for the police chiefs is in the 9 counties is Craig Elick out in Richmond, and in my absence or as my assistant, I shouldn't even use assistant, he's right there with me, is Sheriff Joe Wenner out of Pepin, who was up here Saturday. So I would make one call and they would coordinate that response. That EPS is mostly used for preparations, but also, like Madison, it's going on right now. But if we had something that we got into, an emergency teletype would be sent out to that 9-county region. And if I received an emergency teletype from Eau Claire in a similar situation, we would send who's ever in a squad car now that way. And I anticipate and am comfortable that the others would do the same and begin to backfill to cover their areas as they sent emergency help. And we've done that for tornadoes. We've done that for other natural disasters, both man-made and, natural and man-made. But I'm comfortable that it would be obviously much faster than any mobilization of, as discussed the other night, the National Guard. It would be within, and I'd also tap into the municipalities in this county. So you'd be looking at anywhere from 15 to 20 minutes to 3 to 4 hours, but we would have, I believe, a large contingency of law enforcement.
Are there any other questions for Sheriff Knudsen? Hearing none, I'm sure echo what everybody has said. Thank you, Sheriff, for you and all the work your staff has done and keeping our county safe. With that, we conclude our business portion of our agenda, and do we have any requests for future agenda items? We'll pursue the stepping up Supervisor Hanson at our next meeting, and I continue to follow some of the things we've talked about today. Are there any announcements or correspondence? Ms. Smith? Hearing none, the committee's adjourned. Thank you.